it's like kind of like our art is like the way we see things. Like my beauty, my level of beauty is like something different to you. It's like an objective. It's not objective, it's subjective. It's yeah. We all see it in different with different eyes. But like a lot of beauty is also what makes us happy and what makes our heart like full.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Eliana Lopez, a registered nurse with over 20 years of experience and the founder of Naturalness Med Spa, a luxury aesthetics and wellness brand rooted in precision, ethics, and timeless results. She's completing her family nurse practitioner program this month and has trained with some of the most respected leaders in the industry, including Julie Kaplan, Leslie Fletcher, Olivia Salmon, Dr. Lee, Julie Horn, and others at the highest level of aesthetic medicine. She's also the creator of Injectology Institute, an injector training school designed to elevate providers through advanced anatomy, artistry, and business mastery. Her work is deeply guided by faith, integrity, and the belief that true beauty is stewardship, honoring the body gave us while enhancing it with intention and excellence. So Eliana, welcome and glad to have you here.
Thank you so much, Daniel. I'm happy to be here with you.
Yeah, so let's start at the very top level. How did you first get interested in the medical field?
In the medical field,
Mm-hmm.
oh my gosh, it's been so many years. I've been a nurse for 21 years, 22. I think I forgot. Um, honestly, I was in Colombia and I was a really young mom. I had my son at 15 and I didn't know what to do. I was really kind of fast and that could like bring me some income, and someone suggested nursing. And I got into nursing school and I loved it. And I've been there since then.
Okay. So what led you to transition over to the aesthetic side of medicine?
The aesthetics, I have always loved aesthetics, but I always thought it was really hard to get into the business. So I always was really afraid. I think most of us as nurses are afraid to start our own business, to not have that stable income that we have in a hospital. But I finally found, I think like God put some people in my life, like a few people that like own med spas, and they all encouraged me. So I was working at that time just doing Botox in another med spa every weekend, just going once in a while. And then after meeting all these people and everyone kind of supporting me, I decided to open my own business.
Okay. So, and what was it? I mean, you mentioned that you had some people that kind of guided you in that direction, but what caused you to decide to start your own practice? As you mentioned, it's not easy, but what caused you to want to start your own practice instead of just working for the hospital or working somewhere else?
I think everything that I was doing in life, all my decisions, little by little, were working towards owning my own business. So the last 2 years of my career, I was on administration. I was managing about 6 businesses here in California. So I was learning a lot about the business. I was learning how to budget, how to do human resources, how to hire, how to run a successful business. And it was great because I had to practice with someone else's money and business. So I also got a lot of resources from them because it was a national company. They were like a corporate company where I got lots of training and support. So I think like all that training that I did with them brought me to where I am today.
Okay. So now that you have your practice, I want to talk about some of your common treatments. Like, what are some of the most common treatments your clients come to you for?
Botox, fillers, also radies, a lot of like biostimulators, Sculptra, radies. And we have a ton of weight loss patients. That's probably like our biggest population.
Are you using the GLP-1s?
Yes, we are.
Okay, got it. Now, with the injectables that you do, I know that a common fear people have is being overfilled, looking overdone, being overtoxed. How do you protect your patients from overfilling and overtox?
Oh, like you see the name of my business, naturalness. So I am all about natural results.
Mhm.
I make sure that we don't do too much, that we start always in small, like small portions, especially if you have not done anything ever. I want to always start like let's just try to see how this goes. We can always add more.
Mhm.
Um, Plus, getting overdone takes a lot of product.
Mhm.
So I don't think it's that easy to get those dog lips and like those fake results. Like you have to like use a lot of resources and like a lot of product to do those things. And I usually don't go for that. Like a lot of people they tell me like, oh, I want to look like similar to like what you have, like don't be super frozen, don't be very overdone. So that's what I love to do here.
Okay. So basically I guess the naturalness, where did you kind of come up with that naturalness, I guess the name and also like the feeling? Are we just finding that more and more of clients wanted more of that natural look?
Okay, so the name, I used to go to a med spa in Colombia.
Hmm.
I actually used to travel there every 6 months, and they used to do my fillers, my Botox, and the name of the business was the name of my business here.
Oh, okay. There you go. It's a good though.
When I started looking for a business
Uh,
name, I wanted something that was natural and that like I think my friend had like another business that had like a similar name, and I'm like, oh, this name is so cool. And then one day I'm like, oh, I can use this one.
mhm.
Yeah.
Okay. Now I want to go over to the ethical side of aesthetics. Like I'm sure that you get some people coming in and just asking you to do something that you just know is not going to work for them or it's not going to be a good fit for them. So how do you handle that side of it?
Like if they think they are not a good fit for it.
Hmm.
Repeat your question.
But
I'm
yeah,
sorry.
so I guess like the ethical side of aesthetics. Like if someone's coming in, they want something and you know it's just not going to be a good fit for them. How do you handle that?
Oh no, I'm like super straightforward. If I know something is not gonna benefit you, not just the benefit, but like if I know like you're looking for a procedure that like is not gonna give you the results that you want,
Mm.
I'm gonna tell you like this is not good for you. Like for me, growing my business has been a lot about creating trust and rapport with my patients, making sure that they have like a great relationship with me. Most
Mhm.
of my business has been made out of referrals. So if I don't think you're a good candidate, if I think you're going to have an adverse effect, or if I don't think you're going to be happy with the results of what you're looking for, I'm just going to tell you, no, this is not a good match. We have to find something else, or I'm going to refer you to the specialist that can do it.
Mm.
Like it happens a lot with like eyelids, like there are like or like really deep wrinkles. I'm like, no, like I think we need to go to plastic surgery. We need to look into other alternatives to what you're doing and
Mm.
what you want.
Mhm. Okay. Now, when it comes to these types of treatments, I'm sure that a lot of people are looking for kind of that big reveal or like that big wow moment. Well, really in reality, it's really about getting the benefits long term. So why is it that long term should be more of the focus than just getting that one wow moment or that big reveal that like they're getting this big makeover?
I think like when you have like that long, like the long-term goal, like your results are sustained
Mhm.
through time.
Mhm.
When you like just have like this big wow and you don't do what you need to do throughout the year to sustain that result, those effects just fade really fast.
Mm.
An example is I did a CO2 laser like about 1 year ago, big treatment, but like if I don't continue with like my year-long process of taking care of my skin, using some blocker, making sure that like I use my creams, that like I wash my face, and I do everything that is needed, that CO2 laser big wow moment is just gonna vanish in 1 minute.
Okay. Okay. I see. And kind of within that thread, like some people also kind of has this perception that they can do this themselves or they can just go to a really, really cheap place and it's gonna be the same thing. Like the pricing is doesn't matter. Like if I can get it cheaper somewhere, I'll do that. But what are the dangers when someone does it? They either try and do it themselves or they try and go a really, really cheap route.
Oh my gosh, I have seen so many trends lately, and I think lately is just all over the place. Um, I have seen people ordering toxins from different countries, and I think we got some reports lately that some people got paralyzed.
Wow.
You also might not get any effects. I think one of my patients bought like a Botox bottle for $50, and she injected it herself with instructions from a YouTuber, and it didn't do much for her. But we also like run all that risk of complications, like dropping your eyelids, having a vascular occlusion if you're doing fillers yourself. And also going to someone that doesn't know how to manage those complications, that is not trained properly, is super dangerous. You might end up with a terrible complication and no one that is gonna be willing to treat you because they are afraid to touch you after you have an emergency. So always looking for a person that like has the right qualifications, that is trained, and that knows how to manage a complication is super important when you're looking for a practitioner.
Got it. Okay. And when it comes to these types of treatments, the injectables primarily, what are some of the most common misconceptions or myths that you hear from your clients about these treatments?
I think like it's a lot of like with filler, I hear a lot of people saying, oh, it's gonna migrate and it's gonna go to this place or the other one. And filler really doesn't migrate. It doesn't have little legs and walks. The migration occurs because like we overfill, because we don't inject safely, because we some people like try to like push too much of the filler in one place. So that's one big misconception. The other misconception is with Botox, a lot of, or like with any neurotoxin. A lot of my patients think that they are gonna be completely frozen and overfill from Botox when like it doesn't have to do one thing with the other one. Um, and I think like that conception also that they can tell us how much they need
Mm,
and what they need.
yeah.
And I always put that example, like you don't go to your doctor and tell them, hey, like I just give me like just this little bit of antibiotic and I'll be good with it. Like I
Uh,
just need 2 pills instead of, I just need 2 days instead of 7. No, we don't do that.
yeah.
So I think like a lot of patients come with that misconception. They're like, oh no, like just like I can do this with like 5 units, 10 units, half a syringe. Or like I need 10 syringes, and not trusting that we know exactly what you need, that
Mm,
we know your anatomy, that we have studied that, and we are in charge of making those decisions and
mm,
deciding and letting you know this is what is appropriate for you and for what you're looking for.
mm. Okay, got it. Now, let's say, Eliana, that someone is looking to get some type of injectables done. Maybe they've never done it before, and so maybe they're a little bit nervous. They're trying to find the best provider who can get them the results they're looking for. What
Mhm.
advice would you give to that person as they're doing their search so that they can find that provider that knows what they're doing, is experienced, and can get them those good results?
I think looking at like the reviews in Google,
Mhm,
super important. Sometimes when you have a referral from someone else, it's important to making sure that that person is working in a medical office, that they are have a medical director that is in charge, and making sure that they are certified to do the procedure that you're looking for in that state.
mhm,
All of our states have different guidelines, so just make sure that like the state that you're working looking for like a procedure, that person is actually allowed to do that procedure and is certified to do it.
mhm.
And just looking at the training that they have done in the years of experience. Sometimes it's not even the training, the years of experience. Sometimes you don't need like advanced training, but like you have had so much experience, but like those two things go hand in hand.
Okay, good to know. Good advice.
Mm.
Now, when it comes to the educational part of it, like as I mentioned, you probably get a lot of clients that come in and they just don't really know how this works. They don't know the process. How do you approach educating them on how this process works?
I think it's part of our consultation, sitting with them, doing a good facial assessment, making sure that they understand what is that the procedure that they're going to have done is for. and making sure that they understand the side effects, complications, that they have like good expectations of what the results are gonna be. But that's all part of our consultation process. Our consultation here in the office is usually 30 to 45 minutes. When you come for the first time, we make sure that we talk about everything that you need and that you understand every procedure that you're getting into very well before you commit to doing something with us.
Got it. Okay. And for my next question, I'm curious because you come with a very strong background when it comes to medicine. So, but with aesthetics, I think it's slightly different. So, what role do you think, or how important is it to have an artistic eye in how you approach patient care? Because I think when people think about medicine, they're not thinking about artistry. But how important do you think having an artistic eye is in what you do?
I think it's super important. Uh, and we all have a different eye. So I inject different from different people. Like we like our artistry is different.
Mhm.
So, but it is important to like have your own aesthetic image and see like what is good for us and like what is like what I like and try to achieve those same goals. I think that's why it's super important for all the injectors. I know a lot of injectors and to attract that clientele that is right for me. So I tend to attract a lot of clients that look for natural
Mhm.
results,
Mhm.
usually people that are like a little bit older
Mhm.
and that don't want anything crazy, like middle-aged women, 40 and up. Those are my clients. They don't want to look like a different person. They just want a refreshed look. They just want to balance their faces, make sure that they restore the volume that they have lost. That's what I love. But like I know there are some nurses out there that are like doing beautiful lips that are like more overfilled, and there are women for that. So I think matching that artistry to your clientele is super important.
Okay. So it's I guess it's more the matching the artist with the client.
Yeah,
Okay.
yeah,
Okay.
yeah. And
Got it.
like if someone comes here for like big lips, I'm like, I'm not your girl.
Yeah.
This like I don't do huge like lips. I don't do Russian lips that like are super common right now. Like that's just it's not my thing, but like I can find someone that like will do it for you and that
Mhm.
like is amazing at that and that's their art and they love it.
Mhm. Okay. Good to know.
Mhm.
Okay. Now, I'm sure that Eliana, you've had a lot of interesting cases as you've kind of worked through the years. Is there maybe
Mhm.
one story that you can share of just a challenging case or a memorable case, and how you were able to get them a successful outcome in the end?
Okay, like yeah, I think like one of my most difficult cases
Mhm.
was lady. She used to be a cosmetologist. She's
Mhm.
older, like probably on her 70s, but she came from a different country. She used to inject all her fillers and biostimulators herself.
Mhm.
So by the time that she came to me, her entire face was full of nodules, all her cheeks, eyes, everything.
Wow.
Yeah, it was a really hard case. We spent a lot of time dissolving everything, working through her nodules and filling her face again. And she was really happy with the outcome.
Mhm.
But it's been one of my most difficult cases. It was hours and hours and days of work.
Yeah. Oh yeah, I can imagine.
Yeah.
But you were able to get it resolved for her.
Mostly, like some of those nodules don't go away, but we were able to also, with filler,
Mhm.
blend in the nodules. So like we will put like a little bit of filler around the nodules and kind of blend in like all that unevenness on her skin.
Okay.
Her daughter is actually my patient and she is a doctor. She came this week
Oh.
and she was telling me how happy her mom was and that she actually was not leaving the house for like a long time because she had these nodules in her face and she was so embarrassed of going out. And then after the procedure that she had with us, she was able to start going out again and she was really happy with her results.
Yeah.
So that makes me happy too.
Yeah. I mean, you're giving her the confidence to go back outside.
Yeah.
That's the most important thing. You help them get the confidence back. Okay. So, Eliana, where do you think the future of aesthetics is going?
The future, I think a lot of biostimulators, stopping overfilling faces, regenerative medicine, peptides, I think that's where we're moving. Like
Mhm.
making sure that we do a lot of preventative care too, not like not letting
Mhm.
our skins go so bad and
Mhm.
just taking care of them since we're young. So Mm.
Okay. And do you think, I mean, what do you think is kind of fueling people looking for the more natural look and looking for more wellness? Like, what do you think is fueling that?
I think we got tired of like being fake.
That's a good.
Yeah. Like we have been doing like big implants, big lips, like overfill faces for so long, and trends start changing, and we're also seeing like the damage that like some of these trends have caused to our lives. I
Mm,
think we didn't have enough data when like we started doing so much
mhm,
to our bodies, but as things keep on persisting and we keep on doing them, we get more data. We start realizing like, yeah, all these things are creating inflammation, damage, like, so we tend to go for a more natural look and for more regenerative medicine and more preventative medicine.
okay. And for your practice, Naturalness Med Spa, what's your vision for your practice?
My vision, okay, so my vision this year is to grow the practice. I would love to, in the next year, be able to move out of our office and build my own, have my own building. Right now we have 4 offices here, 4 consult rooms, and I would love to grow it because it's getting a little bit crowded for us at times. So I would love to be able to grow out of here. And I also would love to start implementing this year a lot more of regenerative medicine and integrative medicine and everything that has to do with peptides and yeah,
Awesome. Okay.
hormones, balancing hormones, all that. That's what I want to grow this year in my practice.
Okay, got it. Well, Eliana, I do have one last question for you, but before I ask it, I do want to point people to your website at naturalnessmedspa.com.
Hmm.
Now, last question is, what does beauty mean to you?
What does beauty mean to me? I think beauty is it's like kind of like our art, it's like the way we see things. Like my beauty, my level of beauty is like something different to you. It's like an objective. It's not objective, it's subjective. It's yeah. We all see it in different with different eyes. But like a lot of beauty is also what makes us happy and what makes our heart like full. I think when we see beautiful things, like we feel full and yeah, not just like aesthetically, but like flowers, the world, like our creation, everything that we see that like is beautiful, like make us happy.
Awesome. Okay, well, there you have it. Eliana sharing her expertise. So, Eliana, where can people contact you in your practice?
So our website, naturalismspa.com, and on Instagram, anyone can look for me there. Our handle is naturalismspa, and naturally slash Eliana. So
Okay. Well,
yeah.
Eliana, this is awesome. Thank you for coming on and thank you for sharing your knowledge.
Of course. Thank you, Daniel. Thank you for having me here.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.